Hi, my name is Jasmine. I've quite an interesting float story to share. I was born with Ehlers Danlos Syndrome, which is a connective tissue disorder that makes all of the ligaments and the fascia in my body more elastic, causes all sorts of problems, which turn out to be helped by floating. My Ehlers Danlos started really progressing about 4 years ago when I started having spinal complications, and I started researching the root cause of my problem, which I decided was gravity. I started doing all sorts of things. I started doing my physical therapy upside down. I got into rock climbing, and now I'm a nationally recognized adaptive rock climber. And I couldn't start floating at the time because I had a medical device implanted, which prevented me from becoming submerged in the water. So I got that removed, I think, December of 2016, so really recently. But I had discovered floating maybe 2 years ago, and I read absolutely everything about it. Every week I would talk about, oh, how my life will change when I start floating. And so December comes along, I get this device out, and I start floating. It has increased my quality of life on, I don't even know, some order of magnitude I can't even describe, because what happens is that my joints come out of place easily, but they don't always go back in place easily, because the muscles spasm so bad when um, from the trauma of dislocating. Even though my ligaments are stretchy, my muscles are not stretchy. They're just like on overdrive all the time. So I would get I would walk around on halfway dislocated joints for days, weeks, or even months, because it's a rare condition. Nobody really knows how to help me. The doctors are scared to touch me. Nobody wants to get sued. Anyway, so now I get realigned in the float tank. I've been going once a week or once every 2 weeks at least, and that I walk out of that float tank, all my joints are back in place. It's like a restart. And it's prevented me from, I used to get, well, I still do get tendonitis all the time from all the motion in my joints, but it's really decreased the severity of my different tendinitises and the inflammation and the pain, and it also increases my body's ability to have better proprioception, which is something that I really struggle with since everything's so stretchy. I have a hard time knowing where my limbs are in space. It's like I understand the extremes, but not the mid range of anything. And so when I walk out of that float tank, I can actually sense my body parts better than when I got in the tank, which is especially fascinating because when I go in a pool, I walk out weaker. So somebody's gonna have to figure out how that works, but I'm just gonna go with it. So aside from all the joint stuff, that's just half of what the floating helps me with. I know, it's just crazy. So the other half of Ehlers Danlos syndrome is dysfunction of the autonomic nervous system. It's called POTS, postural orthostatic tachycardia syndrome. It's when the body gets stuck in this sympathetic overdrive. Basically what happens is that since all my tissue is more elastic, I have trouble with blood pooling in my limbs when I'm standing. So whenever I'm standing, my heart has to work much harder than other people's, and that in turn shuts off my digestion. It's basically like I'm in fight or flight all the time when I'm standing or upright in any sort of way. And the floating also resets my autonomic system as well, which is something that I work on a daily basis. I have to basically override my body's natural autonomics every single day, or it doesn't readjust itself. But yeah, floating has been a great time for me to work on learning how to regulate my heart rate, my blood pressure, and also breathing. My breathing doesn't regulate itself in a normal rhythm like other people's do. So, floating is a real treatment for this condition, and this is a condition that has literally no awareness, no hope, no medicines, they haven't even defined all the genes yet. They don't even know if it's really one thing or 10 different things. It's just this bucket of people that have this messed up connective tissue that they don't know what to do about, and any sort of treatment, possible treatment even, is extremely epic and extraordinarily important to share with the Ehlers Danlos community. So I see my role in all of this as trying to educate my therapists, doctors, and other patient organizations that I'm involved with